Maybe you dozed off and missed this one, but we're in the middle of National Sleep Awareness Week. It's a time to wake up and figure out if you're doing what's right to get good rest throughout the night. This is an issue that everyone can relate to.
Yeah, so here to help answer all of your snooze questions is sleep specialist Dr. David C. Brodner. Good morning, Doc.
Good morning. Thanks for having me.
The first question when you talk about sleep is, how much do you need a night?
That's a very common question. Basically, we like to see at least 7 to 8 hours. Now, everybody is different, so there are some individuals, it's rare, but some individuals can get away with less. But in general, I think for everybody out there watching, aim for 7 to 8 hours of good sleep.
Okay, doctor, sorry, was there more?
Well, what I was going to say is good sleep is basically you need to set up an environment where it's nice and quiet, it's cool. We were talking about blackout curtains before. It's dark. You need to make your bedroom kind of a sanctuary so that when you are asleep, you're getting good quality of sleep. It's not just spending 8 hours in bed.
Okay, a lot of people think, they're sleepy in the morning, but there's a fine line between just being tired and then having a sleep disorder. So talk about what are some of the disorders?
Well, there is a fine line, and basically a disorder is going to be anything that's interrupting the quality of your life. If it's interrupting your social activities, things at work. I mean, sure, we live in a busy society. Everyone feels a little bit tired. But if it's prohibiting you from doing what you need to do, then it's probably a disorder, and it's probably time to bring it up with your physician.
And some of these disorders are pretty serious and can have pretty nasty side effects, right?
Absolutely. I mean, sleep is so important for our general health. And some of the more common problems like an insomnia or sleep apnea are associated with serious medical problems. Things such as depression, sleep apnea affects the heart, so high blood pressure, heart attacks, strokes. So it is extremely important to not only get good quality sleep, but if you're not, talk to your physician and take a proactive stance, and we can all get better sleep.
All right, doctor, some of us, we work on a very interesting schedule, and others have newborns at home, others have their cell phone blowing up all the time. So Tylenol PM and other medications like that, that's oftentimes the answer. Right. What do you say about that?
I have a lot of patients who come to me and say, listen, doc, I got a baby, I've got this, I've got a hard schedule.
Yeah.
Well, I've got 4 kids at home, we're adding a puppy on Friday.
What?
So I get my 8 hours, and it's hard. I go to sleep before American Idol or Olympics, but I get my 8 hours, and it can be done. But you really have to force yourself to do it, to schedule your life around something that's important, which we all do. Make sleep #1 priority. So everyone's cell phones are blowing up, the internet. I know you guys have a crazy schedule getting here early. You just have to schedule it and make it a part of your life, rather than most of us use sleep time as, well, we've got an extra 8 hours to kind of catch up on everything else.
Last thing is, you touched on this before, but should people treat their bedroom as just a place for sleep? In other words, if you're going to hang out in the middle of the day and watch TV, should you not do that in your bedroom so you know when you go to bedroom, you go to bed?
And that's an excellent point. We like to talk about the bedroom as just for sleep or for intimacy. So probably watching TV in there in the daytime is not that big of a deal, but we don't want you hanging out in the bed watching TV and then drifting off to sleep or working on the laptop in bed. Do those things outside, and that way kind of you programmed yourself to think of, when I'm in the bedroom, it's time to rest.
Or something else.
Yeah. So, Dave, are you going to stop using Tylenol?
Maybe. I will wean.
Because we have to go to sleep, and Dave has the hardest time sleeping, and you're saying maybe just ditch the Tylenol PM and do other things.
Well, thanks, Doc. We'll more closely examine my personal case during the commercial break.
Yes, we will.
Yes, thank you very much.
Thank you.
For more health tips, for more health tips like how to have the best sleep ever, who doesn't want that, or to find a doctor to help you get to sleep, check out southflorida.com/health.
7:42 and Jeff Melcars. I just want to say, as soon as we go to commercial break, Dave's going to say, really, Kristen?
I got to be honest with you.